its ears. Okay? So flexion and extension literally is just this little motion. Okay? And again, I'm not even picking up Bjorn's head off the table. I'm just rocking it back and forth. Okay? If that head starts to come up, then I'm starting to get at lower cervical flexion and extension. Okay? So from an assessment perspective, I can already tell he is a little limited. It's a little bit more of a stiff kind of end feel, if you will, into flexion. Okay? So this becomes my intervention. This is my active assisted range of motion for OA, flexion, and extension. Okay? Then you did OA side bending, yes? No? Okay? So side bending access is essentially through the nose. Okay? So it's just this little twist side to side. Okay, again, I'm not really picking his head up off the table. I'm just unweighting it a little bit, holding it in my hands, and it's just a little side to side motion. And he's limited in left side bending. Okay, so that could become my active or my passive or my active assisted range of motion. Okay, how'd you do upper cervical C1, C2 rotation? Now you got to pick the head up, right? Okay, so that's when we went into full flexion. Okay. We got some problems here. How much is normal? How much is C1, C2 rotation? How much is it?
45. 35.
Yeah, so about 50% of the motion should come from C1, C2, right? So about 45 degrees or so of motion. Okay, so for my active assisted, I bring him up, I kind of support him on my belly a little bit, okay? Switch my hand position so that if I'm going to the right, he's going to kind of roll into the palm of my hand here, right around the ear. Okay, and again, this is my assessment. It also becomes my range of motion position. Okay, switch my hands a little bit. Other hand cradles the head. Left hand comes on to more the left occipital area for my left C1, C2 rotation. Okay, all right. So I want you to